and learn. We plan for all your changing needs for the right help when you need it. Pampers Stages, inspired by babies.
It's Monday morning, 8:41 a.m. You're watching Breakfast Television.
All right, let's check back in with Tasha this morning and find out if she's found a pair of glasses that she likes, something that suits her. Tasha?
I did, Simi and Dave. I found a great pair of glasses, but we moved on to contacts because that's actually what I wear most of the time. And we're going to talk a little bit about contact care and how to take care of your eyes with that. Now, Dr. Sexsmith, I mean, there's so many different types to choose from now. Where should someone start?
Well, basically, you have an eye exam, and the doctor will check your prescription and see if you need an astigmatism lens or a regular lens or a bifocal contact lens. And then the doctor will look at the health of your eyes and see if you've got dry eyes or if you've got regular, not dry eyes. So all of those factor into what material we use and what optical design we use.
Okay, what's interesting is you actually said you have bifocal lenses.
Yeah, bifocal contacts.
Okay,
yeah.
And when did those come out?
They came out actually quite a long time ago, but they've become, initially they didn't work very well, but now they work quite well. We get quite a lot of success with them.
And how should people care for their contacts? Because I know even though it says 2 weeks, I will wear my contacts for an extra month.
Yeah.
Sometimes.
Well, generally the problem with that is that it can become dirty and you may not realize that it is, and it can cause damage to your eye. The oxygen through the lens can drop quite a bit if the surface is clogged up with dirt, and then you can run into problems. Infections, bacteria like a low oxygen environment. So.
Okay.
Yeah.
Even with contacts with high oxygen, because I know these ones, they even say you can wear them overnight.
Some patients, about 40% of patients actually cannot wear those overnight. You have to first check with your doctor to make sure it is safe for you to wear those overnight. And then if it is, we always recommend you take them out at least once a week or once every 3 or 4 days to clean and sterilize them and give your eyes a bit of a break.
What are some of the symptoms that someone would find if they had a bacterial infection in their eye?
Well, it wouldn't be very pretty. Generally, it would be copious amounts of pus coming out of the eye and very dark red eyes, irritated eyes.
Okay, and then, I mean, a lot of people end up going to their doctor. I mean, is that a good idea? Or?
Well, you could. An optometrist or an ophthalmologist has equipment that you can determine if it is, in fact, an infection. Bacterial infections are actually quite rare. Usually red eyes are caused by other things, like a dry eye or a solution sensitivity, or the contact lens itself is damaging the eye. Or they could have glaucoma. They could have many other eye diseases. So there's hundreds of things that they could have, so it's probably a good idea to see the eye doctor and so that they can diagnose the actual problem and then deal with it appropriately.
Okay. Thank you very much, Dr. Sexsmith. Those are some great tips. Dave and Simi, I'll be sure not to wear my contacts for longer than a month anymore.
Good, see? Good advice, and you learned something this morning. Thank you very much for that, Tasha.
All right, here we go. This is our little trip through the pages of history. Here we go. On this day in 1896, the dial telephone was patented.